Elsie Laurie, the lead National Lassa Fever Technical Working Group, joins me now via Skype to talk more on this. Thank you for joining us. Now, earlier this year, your corporation talked about a decline in the cases of Lassa fever, but over time now, 128 deaths recorded so far, and we are still seeing new cases. Can we still say that there is still a decline?
Thank you for having me. Yes, we can say that there's a decline because we, at the earlier stage when we had the outbreak, we had up to 74 confirmed cases in a week. But now we're having just 4 confirmed cases in a week. So you can see the difference. And so there's a decline in the number of cases. We have actually declared the emergency over because Lassa fever is actually endemic in Nigeria. It is all year round. We are bound to see cases throughout the year. But the peak season, we have overcome the peak season, which was the first week in January up to late April. We started noticing decline from week 5, and now it's continuous. And so, yes, we are recording decline in number of cases.
And now that we know that this case is still on, what should Nigerians do to prevent being a victim of the virus?
Yes, like we always say, environmental sanitation is very, very key. Preventing the rodents from getting into our homes, preventing the rodents from getting into our foodstuff, utensils, personal hygiene, hand washing. That is very key. And we also talk to the health workers to have a very high index of suspicion. If we have fever, high fever, body aches, those are symptoms of malaria. So sometimes you think it is malaria, but when you have taken the anti-malaria and for 3 days it's not subsiding, so we're bound to suspect Lassa fever or any of the viral hemorrhagic fevers. So health workers have been trained to have that high index of suspicion, and if they see any case of as such that I've just mentioned with a high fever and there is not subsiding after taking some anti-malaria medication, you report to the nearest health facilities. The health workers
When you say if the high fever is not subsiding, how long is it expected to subside?
When you take anti-malaria, because when you have high fever, most times you suspect malaria. You take anti-malaria, for the first 2 days, you expected that the fever should subside. But when it's not subsiding, then you report to the nearest health facility, or the healthcare worker should have that high index of suspicion and suspect Lassa. So within 2 days, 3 days, you should be able to say, oh, this is more than malaria, once you start taking the anti-malaria.
Beyond malaria symptoms, what other symptoms should, perhaps people look out for in case to protect themselves, like we have asked?
We have sore throats, that's very key. We have headaches, body aches. We also have abdominal pains. We have different symptoms that mimics the malaria the kind of symptoms you see in malaria. Of course, headache is also key. The bleeding part is actually towards the later stage of the disease. So people should not wait until they see bleeding. They should, once you have fevers, like I said earlier, and it's not subsiding after taking anti-malaria, you suspect. Within 2 to 3 days, you suspect, and then you report to the nearest health facility. In fact, we advise people not to self-medicate. So you have fevers, you should report to the nearest health facility.
Via Skype to talk more on this. Elsie, it's good to have you join me now. Let's talk about the difficulty it has been, because year in, year out, we often have these outbreaks this period of time, and it seems it's not going away anytime soon.
Well, well, I wouldn't say it's not going away anytime soon because it is endemic in the country, and we have cases all year round. But the Nigeria Center for Disease Control has tried a lot. We have done a lot of communication activities. We have done a lot of community engagement. So there is a lot of awareness. So seeing a lot of cases now could be because of the awareness that we have created. And so more people are more aware of the symptoms of Lassa fever, and they are reporting to the health facility. So we're seeing more cases because our surveillance is picking the cases now. The health workers are more, they have a high index of suspicion. They can detect the cases on time. And so we're able to detect the cases, diagnose. Our laboratories we have more laboratories that are diagnosing, they are testing for Lassa fever. And so we will expect to see more cases reported. That's what I mean, because we will have more people reporting to the health facilities because they are aware of the symptoms now.
All right, Elsie, it's good to know that there's a lot of enlightenment campaign going on and people are getting aware. But the symptoms, from what we understand, the symptom of Lassa fever is just like any other fever, which is common, as good, just like malaria or something else. But when you get to the hospitals, most of these checks and diagnoses are for malaria. So how challenging is it?
Well, that's what we have sensitized the health workers to be able to pick these cases. Now, for malaria, you take anti-malaria for 2 days and you're still having fever and the symptoms are still persisting. They have been trained to have that high index of suspicion and suspect Lassa or any of the viral hemorrhagic fevers. So we have trained the health workers. We have trained them to be able to detect the cases on time. So what we want the public to know is that once they have fever and they have symptoms of malaria, they should not self-medicate. They should visit the nearest health facility so that they can easily detect, and they should be able to know the history of when the symptoms started, because that is also very key. Sometimes people do not even remember when the symptoms started. That will help the health worker to be able to suspect that it could be Lassa fever or any other viral hemorrhagic fevers.
All right, Elsie Laurie, the lead National Lassa Fever Technical Working Group, thank you very much for talking to us on TVC Breakfast. Moving ahead now.